Benefits of Botox. Botox in its varied uses offers both medical and cosmetic benefits, offering varied value towards overall health. Botox is defined as botulinum toxin. It's a neurotoxic protein produced by the bacterium called Clostridium botulinum. And then there's two main commercial types, which is botulinum toxin type A and botulinum toxin type B. And then, like I said, various uses are available and should also be used with caution always. Botox overdose or poisoning can potentially occur if it's not used as directed, and now the FDA has actually included a black box warning with Botox. The FDA is okay with cosmetic uses. It's deemed safe per the FDA because usually those uses require a very small amount or dose of the toxin, so it appears to be safe if used as directed. What Botox does, or the action of Botox, it blocks the release of the neurotransmitter acetylcholine from nerve endings. So what that does is it inhibits muscles from contracting. So if you can imagine in an overdose of Botox or in Botox poisoning, the central muscles, like your involuntary muscles, could stop working and the patient or individual could end up dying from respiratory failure. So that can be really scary if it's not used as directed and with caution and by professionals. Throughout this speech, I'll just inform you of three main uses for Botox, or like the most commonly used uses of Botox. Number one is cosmetic purposes, as I'm sure you know. Using Botox for cosmetic purposes, you use it as an injectable, and this is actually kind of like a preventative measure. So what it does is it prevents wrinkles or lines from becoming deeper or worse. So for example, by injecting Botox into the areas of your face that have wrinkles like frown lines or crow's feet, it causes a temporary muscle paralysis, which sounds kind of scary, but it's in a very small. And then every time after that you try to frown or laugh, the creases or wrinkles cannot be made any deeper, and so this results in the fine lines or wrinkles not becoming worse. And this is a temporary fix. It is something that would need to be done about every 4 months. Number two is the use in hyperhidrosis. So hyperhidrosis is the medical term for excessive sweating, and this can affect various areas of one's body. The FDA approved Botox for use against hyperhidrosis of the armpits, and it's also common sometimes in like palms of the hands or soles of the feet, but this would be more painful when getting the injections. Um, as for cosmetic purposes, injections do wear off in this area as well, so you'd have to repeat them. This one says every 4 to 6 months for the excessive sweating issue. Lastly, Botox is also used for treatment of migraine or prevention of migraine headaches. It treats chronic migraines, and it's given at intervals of about 12 weeks as multiple injections around the head and neck, and this tries to dull future headache symptoms from coming. Um, it treats chronic migraine, as I said, and then qualified medical specialists like nurses, nurse practitioners, or medical doctors are the ones who administer the injections in all areas. In cosmetic, hyperhidrosis, migraine headaches, always a qualified professional. Reports do show that patients treated with Botox experience a major decrease in the frequency of their headache days. Um, in conclusion, I personally am an advocate for the use of Botox in all given situations. I don't think it's wrong to use for cosmetic purposes as long as it's used in moderation. I'm not ashamed to say I use Botox myself, and I have for the past 5 years. I'm someone who doesn't tan in the sun. I don't use tanning beds. I try to hydrate as much as possible, and I do not smoke. So I don't want to look like, the Catwoman lady who went crazy with plastic surgery and looks fake, but I'm also very pro preservation of the skin and staying youthful as long as possible.